So today we're talking about kind of the history of the American social welfare system. So we kind of went through different values last week. So thinking about the values that we have, this kind of sets the stage for how those values have kind of fluctuated over time and how they kind of shape and set the stage for the policies that we have in place today, okay? After this week, we'll start getting, this is kind of like a history lesson, I will say that, but after this week, we'll start getting into more recent, current social welfare issues and policies, but knowing the history understands how we got here. So this is like the one history lesson you'll get, hopefully. There will be history integrated throughout the semester, but this is like the main like history class. So if we think about different values, there's a variety of values that kind of, and I don't think we quite got to this slide last week. There's a variety of values that kind of underpin whether people are going to be for or against different government interventions. So when we think about values that would not support government intervention, that would include, you know, if people value individual responsibility, kind of this idea that you're poor because you're not working hard enough, pulling yourself up by your bootstraps, personal responsibility. Those people are going to be less likely to support government intervention. Some individuals are more in support of helping people that they know versus strangers. So especially over time, what we'll see is that, you know, if you think about it, like if a friend of yours was in need or a family member, you'd be more likely to help them than someone across the country or someone across the world. You're more likely to help people who you know. And over time, we've seen a lot of changes in policies where some policies make it that the government provides it on the local level. So if a policy is being provided on the local level, that's where you're kind of helping people in close proximity, people that you know, versus if we're providing aid to like other countries to help them, some people are against that. There's also these kind of this idea of, you know, people who are deserving of help versus people who are undeserving of help. So historically, what groups have been deemed more deserving of government assistance? Yeah, so a lot of like poor children have typically been deemed more deserving of help than non-children, than adults, because kids are kind of viewed as they can't necessarily take care of themselves. So if a family member is not there to take care of them, then that's where the government kind of steps in. Anyone else what other groups would we classify as deserving of help? And it doesn't say that you necessarily agree with this, but like society, do you think classifies what group as deserving? You have other groups of people. Yeah, so single parents have historically gotten more government assistance than, like in the state of Kansas, single parents have greater access to like health insurance than non-parents. So people who don't have kids have a really hard time getting like Medicaid or state-sponsored health insurance versus people with children. So those are two big groups. Any groups that have been classified as not deserving of help, undeserving of government policies. People might be less supportive of providing assistance to them. Able-bodied individuals. So historically, over time, people who are able-bodied, who are deemed able to work, have historically been in this undeserving category. And we'll see that throughout the ages. I think we still see that today, but it was very much like that in the beginning, like in the Elizabethan times, which we'll talk about in the next slide. That's a big group. So on the flip side of that, if we look at groups who are more supportive of government interventions, people who have this idea of social responsibility, helping other individuals, regardless of whether you know them or not, that we should help everyone, and that who have this idea that, hey, it's not just about individual personality characteristics that cause you to be in poverty, and maybe there's some social systemic issues going on, those individuals are going to be more likely to support government intervention. So keep some of these values in mind as we kind of look at the different ages and how government policies and programs have changed over time. So the first kind of times we'll start with is the Elizabethan Poor Laws. So these were passed in England in the early 1600s. We're starting here because the Elizabethan Poor Laws really set the foundation for social welfare in the United States. They set the foundation for colonial times, so for that first kind of time period in American history. So the Elizabethan Poor Laws were kind of the first time, at least in Western culture, that governments were really kind of providing any assistance to individuals. They weren't providing a ton of help, but this is the first time that the government was providing any recognition that maybe there's a group of people who need extra help. However, the government, so the English government, so the national English government told local governments that you have to take care of certain groups of people in your town, okay? So this was not a national response. This is very much, if we think about that idea of aid to those we know, that's where that value is underpinning this, because it was local governments were kind of being provided the responsibility to help poor people in their area. However, it's stipulated in this law that support had to come from the family first, and the local government would only step in if the family was not available. So if you think of like older adults or people with disabilities who might not be able to work, they had to be cared for by children, okay? And like children had to be cared for by parents. So the government wouldn't step in unless there was not a family member who was able to help. So this still kind of wraps into this idea of individual responsibility, that you're responsible for the people around you and the family around you, but if they're not there, then the government's kind of gonna step in. However, the law specifically stipulated specific categories of classifying people as deserving poor and undeserving poor. So the deserving poor were essentially children, people with disabilities, and older adults. So those are the three categories of the deserving poor. And children were provided with jobs. So they were like, you know, once you hit, if your parents had died, you were provided help until you were like 10, and then you were given a job or an apprenticeship. People with disabilities were provided with housing. They weren't provided with a ton of help, okay? So this is just kind of minimal things that the government was providing. However, they had this large classification of the undeserving poor. So these were essentially able-bodied individuals. So able-bodied individuals were provided jobs, and they were sent to workhouses to earn their basic needs. However, if people refused to work in the workhouses, they were like publicly whipped through the streets, and then they were kind of like sent to jail. So this was like really kind of like a lot. It was like punitive for someone to be poor, essentially. They were trying to prevent like people begging on the streets, and to prevent that, they were like, you know, humiliating them and physically like trying to ship them away. So these Elizabethan Poor Laws set the stage for the colonial period. So the colonial period, 1600 to 1800, people are first coming over to the United States. You know, they are coming with the idea of freedom. So a lot of people were kind of fleeing religious persecution. So they're coming to this free land. They view it as this land of abundant resources. And because it's a land of abundant resources, people were especially discriminatory to people who were poor and deemed able-bodied. Because it's like, there's so much around you, so many opportunities. You shouldn't be poor. Why don't you just go get a job and work? And that they really classified poverty to be based on individual characteristics rather than these systemic issues. So they didn't have a strong emphasis on social responsibility. It was very much on individual responsibility. They did show some assistance to poor people through almshouses. Does anyone know what an almshouse is? Anyone heard this term? It's probably a term you've heard, but you don't necessarily know what it is. So an almshouse is kind of like a poor house. So it's some place that poor people can go and they provide different assistance. Almshouses are usually, they're usually run by like religious groups. So a lot of religious groups were the ones who were providing assistance. But again, almshouses weren't like it's not like you were receiving a ton of assistance from these religious organizations. Some of them might be providing like food, some of them might be providing housing. It was very fragmented, and the government was essentially not providing any assistance, okay? So they were really leaving it up to local communities and individuals within the local communities to provide it. So there wasn't any set plan that the local government has to provide certain things. It was kind of left up to caring individuals within each local community. So the values we have: strong emphasis on individual responsibility, strong emphasis on helping people that we know. So this is the colonial period. Then we move into pre-Civil War period. So this is the mid-1800s. This is when we start to have a shift from farming to industry. So there's more people living in urban communities. But we're still seeing an emphasis on individual responsibility, that if you're poor, it's because of something that you did, and a strong emphasis on religious institutions providing assistance. However, it is during this time that we start seeing the establishment of like orphanages and mental health institutions. So some groups of people are starting to be classified as that kind of deserving poor. Again, not that either institution is like a great place to live. In a way, it was kind of just like shipping off people that they didn't want to have to deal with and provide actual assistance for. But this is when, especially like orphanages, started to become a little more mainstream, especially in larger cities. So then the Civil War hits, okay? So the Civil War period is going to be from around the mid 1800s, okay? So if prior to the Civil War, we had a strong emphasis on individual responsibility, and only really children were classified as deserving poor. What do you think, if we think about, like a lot of times when we see these kind of shifts in values and shifts in policies, a lot of them you have to understand the context, the historical context. So if you think about the historical context of the Civil War has just hit, okay? So we're kind of reeling from the effects of the Civil War. How might that have changed people's ideas related to the government providing intervention? What kind of things happened in the Civil War that might make people more or less likely to support the government assistance? Especially if you think about like deserving groups that might be more deserving of assistance. Yeah.
Well, if slaves became free, then people might feel like, oh, well, they were slaves for this long, to help them because they went through all this stuff.
Yeah, so one large group of individuals who are now kind of viewed as kind of deserving of help are the freed slaves. So there's this large group of people that, obviously this is going to vary based on the location, but we do see the first emergence of what's called the Freedmen's Bureau. So this is the government set up services for recently released slaves. It was temporary. It didn't last very long. The amount of services that they provided wasn't extensive, but there was some recognition that this group kind of needed some additional assistance, okay? What about other individuals who might have been affected by the Civil War? How do you think, and it's probably in front of you, but how did the Civil War affect other values? Yeah, so a lot of men went to war, which left their households really struggling financially. And not all of those men came back. So, or if they did come back, they came back disabled. So there was, following this, the Civil War was the deadliest war in American history. So more individuals died as a result of the Civil War than any other war in American history. And it was all on American soil, and there were, you know, the whole country was engaged in this. So lots of men died, which left their family struggling economically, or they became disabled. A lot of properties got ruined. So we just saw a lot of changed values as a result of this historical moment. And this is where we first start seeing this idea of social responsibility. So we first start seeing this idea that, wow, there are these individuals who need help, that they can't work. They're no longer able-bodied when they once were. And the reason they're not able to work is because they were fighting for their country, they were fighting for their values. So maybe we need to help them. So we start seeing like the seeds of social responsibility start to germinate at this time. So this is when local governments started to provide assistance to individuals who had become permanently disabled as a result of the war. And again, this is when we start to see some government assistance for recently freed slaves. Okay, so our values are starting to shift because of this idea that maybe people are poor and it has nothing to do with their individual choices. Maybe there's other reasons that poverty exists. Following the Civil War, we have the Progressive Era. So this is the late 1800s to early 1900s. One thing that happened during the Progressive Era is industrial expansion. So lots of people are moving to cities. Okay, so before this, people were mostly living in rural areas. There's been widespread urbanization. So now millions of people are kind of flooding into certain urban communities. How would growth in urbanicity, how would more people kind of be congregating in the same area, how might that affect social welfare? Compared to if everyone's in rural areas, yeah. More demand in a central location. So if you think about how welfare services are provided, if everyone's living in rural areas, it's really hard to offer social welfare services. You know, if you're from a rural area, you know, if you've ever had to go to the doctor or access any services, it can be really challenging because people are spread out more. So one of the things that urbanization allowed is it allowed services to be more centralized. So it was just easier to provide social welfare services, especially from like religious groups or other kind of nonprofits, because people are more congregated. The other part of urbanization is poverty is easier to see. You can physically see poverty. So like the rural poor are typically a lot of times classified as the hidden poor. When you can't, you know, when your closest neighbor is a mile away, you can't physically see all of the problems that they have. But when there's 1 million people in New York City living in a tenement building, you can physically see these negative, really, really bad living conditions, bad working conditions. It's easier to see. People are more aware of just how widespread these problems are. That, wow, it's not just one person who's struggling, it's 1 million people who are struggling. So because of these two kind of reasons, we start to see social welfare really take root during the Progressive Era. So this is when a lot of social service agencies started. So like the most number of nonprofits were founded in this Progressive Era. And part of that is it's still the emphasis is on non-government sources providing assistance. okay? So the government is still not taking a really large role in providing social welfare services. It's still mainly individuals, nonprofits, or other social service workers who are providing the help. But we're seeing some additional help being provided. So whereas before, people had this idea that it was only about individual responsibility, now there's more people who are really kind of grabbing on to this idea of social responsibility and the need to help other people, okay? This period also brought about increased poverty. So there were, if you think of like this period is when like a lot of immigrants were coming to the United States. So this is around like the Great Potato Famine. So a lot of poor immigrants were coming to the United States for jobs. So there was increased poverty. There were increased jobs. So there were jobs available in these urban areas, but it did kind of, again, it brought together a lot of poor groups of people who were in need of help. So a lot of this assistance was being provided by voluntary religious organizations. One of it, there were the two groups, if we think about how social services are provided today, the two kind of ways we provide social services. So if we think about like I try to be more broad and not just be specific to social work, but if we're thinking about social work in general, we typically think of micro social work versus macro social work. So micro being providing micro social work services means you're an individual providing one-on-one assistance to someone else, okay? So if you're a counselor, if you're a case manager, if you're going into someone's home, if you're directly working with homeless individuals, that's one way that social services are provided today. The other way is through what we classify as macro social work practice. So these are essentially like government community-wide interventions. So when we think about government policies, government programs, people being provided Medicaid, Medicare, WIC, all of that is considered on the macro level, so it's on the community-wide. So both of these different areas of social welfare that we have today really took root in the progressive era. So the first thing we have is what's called charity organization societies. So these individuals classified themselves as the friendly visitor program. So they were like the first case managers. So they were physically going into people's homes and kind of teaching them how to be better people. So the charity organization societies still kind of had this kind of outdated view that poverty had to do with individual characteristics and individual behavior. So their idea was, if we teach people how to be better, then they will be better and we'll be able to pull them out of poverty, okay? So they're kind of the first case managers, the first people to go into people's homes. The other thing we had during this era was called the settlement movement. So if you've taken Social Work 100, you probably learned about the settlement movement. But essentially, these are individuals who are looking more at the larger systemic issues underpinning poverty, okay? So they were working on community-wide efforts. So they did a lot around health. So they did like tuberculosis prevention. They set up well baby clinics. So they set up like clinics for like prenatal care. They worked on child labor laws. So this is more, again, it's more at the macro level, more at the systemic level, that these individuals kind of recognized that there's a lot of people who are deprived out there. And if we want to help the most number of people, we need to be providing services more on the community level and let people kind of receive our help. And they're much more in tune to social responsibility versus the charity organization societies were much more on the idea of individual responsibility, that people have to help themselves, but we're going to give them the tools to help themselves, okay? So that's the progressive era. The emphasis on the progressive era is social welfare is taking root. However, the government is not the one who's providing the services, okay? The government still has very minimal involvement in social services. How did that change in the Great Depression? what happened as a result of the Great Depression that might shift people's values towards social responsibility. Mm-hmm. Yeah, so the Great Depression hit in, it was the late 1920s that the stock market crashed. We had 25% unemployment, so there was a widespread number of individuals who didn't have a job. So these were able-bodied individuals. Everyone in America during the Great Depression knew someone who lost their job. And they knew that this person's not lazy. They lost their job because of the stock market crashing and the economy tanked. And they kind of recognized that, hey, it's not this person's fault. It's not because of a personality flaw that they lost their job. And because individuals are able to really kind of connect someone losing their job to a widespread social problem, they're going to be more in alignment, more in agreement with the government providing social services. So this is the first time that the federal government is providing widespread assistance. Okay, and they do have a variety of things to kind of assist people. One of the big things that they did was physically create jobs. So the government had, they hired people to start national parks, to build bridges, roads, a lot of specific tasks that they could kind of try to get people back to work. The other thing that the government that came about during this period, again, this is a major systemic change in how the government is operating. The other thing we see is the Social Security Act of 1935. So this is the first time that the federal government is providing direct monetary assistance to individuals. So during this period, it was essentially providing help for people who were older and people who were poor. Those are the two groups who are now kind of classified as that deserving poor. And not that they hadn't been classified as deserving poor previously, but this is the first time that the government is really helping them. So the first part of the Social Security Act, and we'll talk in great detail about the Social Security Act later in the semester, but it is important to understand when we're thinking about the history of social welfare. So the first part of the Social Security Act is social insurance. So this is what's considered an entitlement program. And it's an entitlement because people receive it, workers receive it once they reach a certain age, okay? So people feel they are entitled to their Social Security benefits because they have been paying into the system as they've been working. So older adults receive it based on how much they worked when they were employed, okay? The other part of the Social Security Act is public assistance. This is direct kind of cash assistance to mainly single women and infants and children were the ones who were receiving it. Okay, so those are the two areas where the government is really providing help. At the time of the Great Depression, so in the mid 20s and 30s, older adults had the highest poverty rates in the country. So it was like over 50% of older adults were in poverty because they couldn't work anymore, okay? Today, because of Social Security and because of other benefit programs, older adults have some of the lowest rates of poverty. So less than 10% of older adults are classified in poverty. Not that older adults are like super rich. All of them are like super rich. Some of them are like just above the poverty threshold, but because of Social Security, they at least have like a minimum income that is able to help them get by, okay? So we do have, children have the highest percentage of being in poverty in the United States because we don't have as many programs to directly provide cash assistance to kids versus we have Social Security to make sure that older adults are provided with assistance. Okay, so after the Great Depression, so if we think about the values that we had in the Great Depression, a lot of them were shifting towards government intervention because of the effects of the Great Depression. So after the Great Depression, we have World War II, okay? So who knows how the US economy was like after World War II? Anyone know from history class? We have the Great Depression in the mid-1920s, World War II hits, and now we're in like the mid-40s, 50s, early 60s. Anyone know what the economy was like during that period? Yeah. So they were rationing during World War II. During World War II, there was widespread rationing because a lot of food was going to help the war effort. After World War II, the US economy was booming. It was really, really good. It was a great economy, okay? That's what happens when you like kill off all of your enemies. Our top economic competitors were decimated in World War II. So the US, when they emerged victorious, their economy did really well as a result. So the US was like one of the few economies that were doing well after World War II. So how do you think values when economies are doing well, when we have plentiful jobs, how do you think people's values towards government intervention changes compared to when we had the Great Depression? Do you think people are going to be more or less likely to support government interventions when the economy is doing well? Less likely. Why are they going to be less likely to support government intervention if the economy is doing well? Why would we be less in support of government intervention? Yeah.
Well, partially because the economy as a whole looks good, we might not see the poverty as much, but then also because they figure, well, the economy is great, there's all these jobs, why don't you work?
There's lots of jobs. There's lots of things that you should be doing. The government shouldn't have to take care of you when the economy is doing well. So one of the trends we've seen, and we're still seeing that today, the trends we see with regards to whether we're going to support the government involvement in social welfare it really is linked with, a lot of times it's linked with the economy. So when the economy is doing well and there's plentiful jobs available, people are going to be less likely to support government intervention, because if you think, we still have this idea of the deserving and undeserving poor. So a lot of people still feel that if you're able-bodied, if you look like you can physically work, you should be working, and you shouldn't be kind of dependent upon these government handout programs, okay? So if there's plentiful jobs, people don't want government programs. When there's not plentiful jobs and it's more apparent the extent of poverty, and it becomes a little more personal, maybe you lost your job, or you know more people who've lost their job, that's when people are going to be, bless you, more likely to support government intervention. So in the booming situation after World War II, once the economy kind of got back on its feet, people had lower emphasis on social responsibility, okay? The one thing that did emerge as a result of World War II, similar to if we think about the Civil War, because a lot of people kind of became disabled, a lot of vets became disabled or were in need of assistance after World War II, there were increased services for veterans. So this is when the GI Bill came out, which provided like housing assistance, educational assistance, and increased like disability benefits for people who had become disabled. But other than that, the government was not really engaging in additional social service efforts, okay? They started to draw back on the Great Deal. We still have, the Social Security Act is still in place, but it's not expanding as much, and there's not other social services being provided. Okay, then we have a period of social reform. So in the 1960s, we start to move back into a period of the government providing additional assistance. So 1960s, this is when Kennedy and Lyndon B. Johnson are president, okay? Does anyone know any major pieces of federal legislation that got passed in the 1960s? What did we learn about earlier today that got passed in the 1960s? Hannah, what got passed in the 1960s? What did you talk about earlier today that got passed in the 1960s? Civil Rights Act. So the Civil Rights Act was one of the biggest pieces of legislation that got passed in the 1960s. So that got passed in 1964. One of the reasons, so this is a situation that is kind of linked with the economy. Essentially, there is this major report. So when Kennedy became president, one of the things that he did was he appointed someone to be in charge of economic opportunities, okay? So he had someone go into the deep South and understand how many economic opportunities they had available in the deep South. And they produced this scathing report that showed all of these disparities between groups, especially with regards to differences by race. So there's always, not this is the first time, but this is really the first time the government has really spoken out that, hey, racial disparities are a problem and there's major differences, especially when we look at southern states and across the whole country. So this is when a lot of Americans are starting to really recognize that maybe this is a problem that we need to address. And part of it was because of this report. So along the way, throughout the 50s, this is when civil rights demonstrations have been starting to increase. But this report kind of helped spark some recognition, additional widespread recognition that this is problematic, okay? So as a result, we have a broad sweeping policies called the War on Poverty in 1964. So this is by Lyndon B. Johnson. So the War on Poverty programs created the Office of Economic Opportunity. So this is when we see AmeriCorps started, Youth Corps, which provides job training for adolescents, Head Start, which provides early childhood education for low-income individuals, started during this period of time. This is when food stamps were started. Okay, so food stamps is a major piece of federal legislation, anti-poverty program today. This started in the 1960s. And this is when we also passed the Civil Rights Act and Medicaid and Medicare. So Medicaid and Medicare is the first time that the government is providing health insurance for individuals who are in poverty, essentially. Okay, so these major pieces of legislation are coming about in the 1960s. So then we're in the late 1960s, early 1970s, okay? So what major world event happened, or if you're thinking about your history class, a lot of these are tied to major world conflicts. When we think about world events, what major world event was happening in the late 1960s, early 1970s? I know none of us were alive during this time, but what was happening in the world in the late 1960s that were kind of consuming the world and consuming the United States? Thinking about wars and conflicts. Vietnam. So this is the Vietnam War, okay? So how might the Vietnam War, were Americans in support of the Vietnam War? No, Americans were not in support of the Vietnam War. As a result of the Vietnam War, so if you look at all of this progress that we made in the 1960s, this massive war on poverty happened in the 1960s. The Civil Rights Act happened in the 1960s. all of this was going on. We had really, really, really good momentum to help people and to expand social welfare. When the Vietnam War hit in the late 1960s, that took all of the government's attention away because it was extremely expensive and required kind of like this idea of all hands on deck. So any efforts we made in the 1960s in civil rights or in social welfare benefits kind of ended once the Vietnam War started, because it physically drew attention to this war effort. The other thing that it resulted in is widespread government skepticism. A lot of Americans were not in support of the Vietnam War. We were fighting a war for someone else, is how a lot of people viewed it. A lot of young men were being sent off to Vietnam and either dying or becoming extremely disabled. And people just didn't understand why this was continuing. So as a result, people are skeptical towards the government. And when they're skeptical of the government, they're going to be more skeptical of government involvement in anything. Okay. So there has been it's called retrenchment. So it's when we our policies became more conservative and shifted away from social welfare services. So if we think of who was president during this time, so the 1970s and 1980s, so this is like Nixon's president, Reagan was president for most of the 1980s, and Reagan was not in support of social welfare services. So he was very much into what's called, I know, this is not an economics class, I promise. It's called Reagan economics. If you've taken an economics course, it's the idea that we should support businesses, and then the businesses will create jobs to hire people. So Reagan, you don't have to know this. This is just a little tidbit. Reagan, during this period of time, the government was very pro-business and very anti-giving assistance to individuals, okay? So there's very much a shift away from social welfare services during this period for a variety of reasons. The other part of it is when services were being provided, they were typically being provided to through local governments. So shift away from the federal government to local government. So in comparison, if you think about the New Deal, so during the Great Depression, the federal government was providing all of these benefits, okay? The war on poverty in the 1960s, the government was providing a lot of those benefits, a lot of those widespread policies. That was from the federal government. Now they're kind of like, we're just gonna make state governments be in charge. We're gonna let state governments kind of do their thing. We'll give some help to states, but we don't need this to be a large federal government. So it's really a scale down of the federal government. So during this time, who remembers from the video that you watched, what happened to welfare reform in the 1990s? So in the 1990s, we're still in this period. So what happened to welfare reform in the 1990s? Anyone remember how it shifted? Like what changed in cash benefit assistance programs in the 1990s? What was one of the big shifts that we saw? So, okay, who passed welfare reform? What president passed welfare reform? Clinton. So Bill Clinton passed welfare reform in the mid-1990s, okay? So he was a Democrat, but the Congress was controlled by Republicans, so it was kind of this bipartisan effort. But yeah, it was very kind of a shift towards away from the government providing assistance. So we see a change in welfare shifting towards personal responsibility, okay? So these cash assistance programs, so we'll talk more about cash assistance programs later in the semester. Again, this is just kind of giving you that historical overview. But one of the biggest shifts in cash assistance programs is, number one, it provided a time limit on how long people could receive benefits. So now people could only receive cash assistance for up to 5 years for the federal government. And states could choose to make that even lower. So I think in Kansas, you can only receive it for 2 years, I believe. That's the current policy, which again, we'll talk about those specific policies later in the semester. But in general, it's now temporary. The emphasis on this is temporary assistance, and they also provided work requirements. So if you were receiving this cash benefit program, you had to either be looking for a job or you had to be attending some sort of job training program, okay? So the emphasis is really on personal responsibility, that there was an increasing number of individuals who were receiving cash benefit programs, and some people thought that, if they're receiving cash benefit programs, that means they are kind of not looking for a job when they could be looking for a job. So we're still really very much seeing this idea of able-bodied individuals. So they do not think that able-bodied individuals should be receiving cash benefit programs for a lengthy period of time. So that's why they have these work requirements. And as a result, there was this major drop in the number of people who were receiving TANF benefits. So the other thing that happened during this period, so the mid-1990s through late 1990s was actually a period of economic growth for the United States. So the economy was doing well during this period of time. So again, during times when the economy is doing well, people are going to be in less support of government interventions. So people supported getting rid of the cash benefit programs because the economy is doing well, there's lots of jobs. We shouldn't be providing help for other people if they can just go out and get a job, okay? However, all of that kind of started to shift. We're just gonna skip that. So it shifted in the next period. So what we saw in the mid-1990s in like the 80s and 90s, during this period of retrenchment is we're really shifting away from wanting government interventions back to these values against government interventions, okay? So the emphasis is back on personal responsibility and only helping people that we know, okay? However, what we've seen since then, so in the past 2 decades, we've had like 2 major economic downturns. Who knows any, so like in the recession, in the Great Recession of 2008, lots of people lost their jobs. People were more in support of government welfare programs. So can anyone name any or like explain any government programs that came about during the recession? Anything that the government did to help people in the recession? Yeah.
Wasn't there, like I know now we have the stimulus check that was there something similar, but it was like a tax?
Yeah. So they essentially had a stimulus check in 2009, I believe, that Bush passed. So it was based on your taxes. So if you were low to middle income, or most Americans received it actually. I think you had to have like incomes over, it was similar to what was just passed under the CARES Act. So it was like most middle to low income individuals received like a cash rebate tax assistance from the government in response to that. So most people received this. They also expanded unemployment benefits. So people could receive unemployment benefits for longer. So again, that's kind of has this recognition that maybe people are out of jobs because there just aren't jobs available. So people were more in support of the government providing that assistance through the expanded unemployment benefits. We've seen those same unemployment benefits recently, within the past few months, in response to the current economic downturn. So people are more in support of unemployment benefits, again, because lots of people lost their jobs and they kind of recognize that this is something more systematic rather than based on individual characteristics. So in the past 20 years, there has been renewed government programs for social welfare. in the past 2 decades, I mean, we had 9/11, Hurricane Katrina was in the early 2000, like 2005. We also had, again, the recession. All of these different events kind of triggered greater support for the government being involved in social welfare services, especially when it comes to healthcare. So up until this time, the government wasn't super involved in healthcare. We had Medicaid and Medicare started in the 1960s, but the government is kind of taking more of an active role in healthcare. So they started providing prescription benefits, which they didn't have before. Expansion of children's health insurance. So now kids up until like 200% of the federal poverty level. So if their families earning like $30,000 or less, something like that, they can receive health insurance. The kids can receive health insurance. Some states have expanded Medicaid for adults. Kansas has not. So you still have to be like really, really poor in the state of Kansas as an adult if you don't have kids to receive, or even if you do have kids. If you're an adult in Kansas, you have to be really, really poor to be able to receive health insurance. But the Affordable Care Act did kind of pass a bunch of, a variety of new healthcare initiatives aimed at kind of expanding the government's role in health insurance, okay? And this is the last slide, but essentially, I mean, all of this is gonna change. We're gonna have to see how, the next time I teach this class, it's gonna be very different to incorporate how the election changes things, how, COVID-19 has changed the social welfare system, because the government has, I mean, I think we've seen just over the past 2 months, both sides have really supported some level of government intervention. I know there's current bickering over what to be provided right now, but there has been some major pieces of legislation that have been passed. The CARES Act that was passed in like March or April provided like $1 trillion in assistance to individuals, to businesses, to hospitals. That was larger. What's been passed in response to COVID is already twice as much as as the government welfare programs that were provided in response to the recession. So the government has taken more of an active role. And while politicians have been fighting over how much the government needs to be involved, both sides agree that the government needed to do something in response to the current economic situation. Again, because we have this economic downturn, there's more widespread recognition that the government needs to be taking more of an active role, okay? Okay.